All right, my name is Paul Thomas. I'm a family medicine doctor, and I started Plum Health Direct Primary Care. It's the first and only direct primary care practice in Detroit, Michigan. And what I like to say is we deliver the best primary care service in Detroit. In 15 months, we've gone from 0 members to about 250 members, and with $11,700 in revenue in December. We've been featured on WDIV, in Crain's Detroit Business, and at TEDx Detroit. We add about 21 new members each month for about $750 to $1,000 in revenue per month. Our mission is to deliver affordable, accessible healthcare in Detroit and beyond. Now, you may not have heard about direct primary care, but it is a new and innovative model that's coming across the country and growing rapidly. When I started my practice, there were only about 400 people doing direct primary care across the country. Now there's about 750 to 800 doctors practicing direct primary care medicine. Importantly, we still remain the only market player in Detroit and really Southeast Michigan. There's some concierge practices up in Oakland County, and the nearest direct primary care practice is at your choice, about 45 miles west of us. Importantly also, there's a lot of demand for direct primary care. A direct primary care doctor created this website called iwantdirectcare.com, and every red dot is somebody who said, I want direct primary care services in my community. So let's take a step back and talk about why healthcare costs so much. So essentially what happens is when you pay your insurance $1, that dollar is split between the overhead of the insurance, the overhead of the clinic, which is typically 50%, and so your doctor ends up with about 30 cents. In a real-world example, say you have strep throat or pneumonia, you pay $130 for that service, that doctor ends up with 40 bucks. Now, doctors, I know what you're thinking, doctors make enough money anyways, right? Why do I care? You care because now doctors are seeing more and more and more patients in less and less time. So instead of a half an hour or an hour with you, you get 10 minutes, maybe 8 minutes. So what we do at Plum Health is we remove these middlemen, okay? We remove all those middlemen and we put in direct care. Now when you pay $49 for the monthly service, the doctor receives $48. We have a 2% credit card fee that we have to pay. What that allows us to do is spend a lot of time with our patients. Typical visits are about an hour. We really get to know and understand the people that we take care of. We get to listen, and I even make house calls in this practice. So in terms of our growth, this is something I put together when I launched my company. It's our break-even analysis. We're currently at about 250 members, and we're on track with this revenue. We're about to bring in $12,000 to $13,000 this month, and our overhead is about $5,000 each month. Our next level would be to grow into a larger office space that would accommodate 3 doctors and 1,500 patients and maybe a nurse or 2. So this is our projection for that. In terms of traction, we were featured on Inc.com, on Channel 4 News. We are also a Motor City Match winner. We earned $50,000 through that competition, as well as $7,500 through Retail Boot Camp. Now you might be thinking, is this legal? This can't be legal, right? Paying a doctor directly. There's a line item in the Affordable Care Act that does make this legal, and there's also a state law that allows this sort of practice as well. Our customers, 65% are Detroit residents, and 35% are coming in from the suburbs. Like I said, we're the only one that offers this sort of direct primary care service in Detroit, so people are coming from other communities to receive this sort of service. 70% have insurance, 30% are uninsured, and we started enrolling large employer groups. Our largest employer group is 16 members. So of note, there are a few market competitors. The pricing for our model is listed here. Over the last 5 months, we've averaged about $10,700 in revenue, and our monthly expenses have been about $5,400. And that's it. That's Plum Health. Thank you so much.